The one up in northern Michigan. This is the one, which sounds like another one, but whatever.
Well, it sounds like Werewolves of London.
It does. Yeah.
That's exactly it.
Yeah, it's got the Werewolves of London,
Right.
and a little bit of Sweet Home Alabama and Werewolves of London
Yeah,
both
exactly.
in it.
But supposedly Kid Rock invented this song. I mean,
I think Kid Rock will admit that there's a Warren Zevon and Sweet Home Alabama.
That
I
he
mean, the
stole
Sweet
this?
Home Alabama is explicit in the song.
Maybe
Right.
it should be Sweet Werewolves of Michigan.
Right,
could do that.
Sweet Wolverines of Michigan.
David Stokes with us, who is the Show Me Institute policy analyst and our good friend, joining us once again on normally on a Monday, but he's doing this on a Tuesday. Good morning, David Stokes.
Good morning, McGraw. Good morning, Sharon.
Good morning.
What is the St. Elizabeth Hospital in Belleville moving? What's that story about? What has that you all upset over?
It has me upset because it's another example of restrictions on competition that we see all throughout our economy, where government placing limits on how businesses and markets can operate. And what you have with St. Elizabeth's is because of Illinois' certificate of need regulations, for them to simply want to move their hospital a few hours and for them to pay for it.
A few miles.
A few miles, right?
Yeah.
Did I say?
I think you said hours, a few hours.
A few miles. They have to go through this elaborate process in Illinois where they receive permission from a state agency simply to move their hospital. And we have the same regulations in Missouri. They're called Certificate of Need regulations. And they're just a completely a terrible restriction on the rights of hospitals and doctors and medical providers to operate. And they're really harmful. They're one of the reasons why healthcare in this country is so expensive. Now, they're not the biggest reason,
right?
But they're one of them.
Well, what about the underserved? Like, hospitals wouldn't want to go to rural Missouri; they'd much rather go to St. Louis. So, isn't that a situation where the larger cities would be better served, and the smaller cities would be underserved, and so therefore you need some type of regulation there?
Well, that is true what you said, but you don't need certificate of need regulations to address that. They, in fact, inhibit it. If you wanted to open a hospital, a small clinic in rural Missouri, I mean, you have to go through this expensive process for a certificate of need passed. You shouldn't have to be able to do that. And we've seen that where people want to open small clinics with a few beds in them.
Right.
In sort of the exurbs there, and hospitals out in Franklin County or Jefferson County, they'll oppose that. And they're placing limits on the ability of doctors and medical providers to expand services to underserved communities. And you'll see it in North St. Louis, too, an underserved medical community like that, where Paul McKee is trying to open a small medical clinic there, and he's going to have to go through this very expensive certificate of need process, which he should not have to do. Patients and doctors and customers should be making these decisions, not boards made up of the competition.
But don't you have to kind of err on the side of caution, to make sure that all of this happens, in a very legal and thoughtful manner?
Well, that's the good news for the argument about certificate of needs is that it's been proven not to work. The federal government had national certificate of need laws passed in the 70s, and the federal government admitted that it was a failure, so they got rid of them in the 1980s. They didn't hold down health care costs. They were passed because there were concerns that if you overbuild too many medical facilities, and in an effort to make back your costs, you'll have to charge higher prices. That was the concern. Somehow that is really what the argument was for it. To limit competition, you'll save money.
What were they smoking that day?
Right.
If
well, it was the early 70s.
If we build too many houses, the housing prices might go up too fast.
Well put, McGraw. Exactly. It was the same argument. So the federal government got rid of these regulations because they realized they weren't working. But states have, unfortunately, some states have kept them, including Missouri and Illinois. And there are economic studies of their effectiveness that say they simply don't work. They hold down costs. They do nothing more than allow hospitals to become a cartel, like the taxi cab industry, like hundreds of other industry boards or commissions out there.
St. Elizabeth is trying to move, and so they have to apply for this certificate of need. Do other hospitals have to sign off on it? How does that work?
Other hospitals get to weigh in and oppose it if they want to. Now, they can't automatically block it. I mean,
Right.
You have to go to a board or commission, which gives St. Elizabeth approval to move. I mean, it's crazy. They should not have to get government approval to move their hospital.
Right.
If they want to spend their own money to move their hospital to improve, expand, whatever their services, they should be able to do it. And other hospitals, like Memorial Hospital in Illinois, who is opposing the move and expressing concern about it, they shouldn't have a say in it. We had this with movers in Missouri until a few years ago, where if you wanted to open a new moving company, then the other moving companies in Missouri got to go before a board of commission and argue that you shouldn't be able to do it. I mean, it's absurd. And that was
Come
only
on,
thrown
there
out
was
because-
really a rule?
Right. And it was taken to court and lost in court. So finally they got rid of the moving board where existing movers got to prevent new movers from coming into the market.
Almost as absurd as the taxi cab commission telling Uber and Lyft not to come into town.
It's the same thing. In the case of hospitals and certificate of need, it's bigger, it's more money at stake.
Right.
But it's the same argument. And that's why I love the opportunity to talk about these issues on your show, McGraw, and that there are so many examples like this throughout Missouri and throughout the country where government steps in and harmfully restricts competition in the economy in all sorts of ways.
in the name of trying to do good.
Always in the name of public safety or protecting the children or
Right.
doing good. And inevitably, they form these committees, they form these commissions, and the existing businesses that dominate the commissions from the start
Right.
use them to restrict competition.
Boy, how'd you like to get through that argument? We can't build more hospitals. That means it'll cost more money.
That was the argument they made. And even the federal government realized that it was a bad argument and got rid of the laws. And it's time for Missouri and Illinois to do the same thing.
So if St. Elizabeth wanted to move, they would at one point needed a certificate of need from the feds as well as the state?
Right. Thankfully, they now just have to go through the Illinois process, which I'm sure is bad enough. And Missouri's is plenty bad, too.
Right. Do you know that when I first got into radio, I had to register for a license to be on the radio? Now, that's all since gone away. But I had to fill out, it was $35, and I had to sign something, and then I had to get a radio license.
There's hope. There are. We see it with
Yeah.
Uber and Lyft as people are fighting back. There are people realizing now that all these economic restrictions are very harmful. And with Certificate of Need, we have a series of blog posts on our blog, showmedaily.org, and I hope your listeners check it out.
David Stokes, thanks for checking in from the Show Me Institute.